Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is another of our COVID conversations. And today we have more because we're going to be talking with Brian Mahoney, who was one of the epidemiologists at Douglas Public Health Network about childhood immunizations. And so childhood immunizations are one of the most amazing things that we've done in medicine, and they've sort of fallen a bit behind during the pandemic, but we'll get to that today. We also have a time today to answer your questions. And if you have further questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll go ahead and get to them. As always, we started out talking about COVID, how it's doing in the world, how it's doing in the US, in Oregon, and then locally. And I can tell you in the world, it's a pretty quiet time for COVID. COVID cases are generally decreasing through much of the world. We're still seeing some increased number of cases in Europe. Australia, New Zealand, which did not have a lot of cases before, are seeing an increase in cases. And South Korea has seen a lot of cases over the last month. We're also very carefully following China. As people may know, China had very little COVID early on, and now it's having a big outbreak in the Shanghai area. Although the number of cases is low, they've really instituted strict lockdowns. And so we'll get a chance to see what happens in China. They can do lockdowns in one area, but if this begins now to spread more widely through the country, they may need to adopt a different strategy. In the US, cases are slightly going up. Mostly those cases are in the New York, New England area and in Washington, D.C. Also, Puerto Rico, which started early with Omicron in December, is now having a little bit of a spike. These spikes back in New York and New England and Puerto Rico are mostly to the BA2 variant, which is like a cousin of Omicron. Very similar to Omicron in very many ways, but is there. And then this BA2 variant has sub-variants from that. So you may see stuff like BA2.12.1. Well, that's a variant that comes from the BA2 variant. So I think we are expecting to see this as the disease spreads. We will see some variants, but these new variants that we're seeing don't seem to be more dangerous. They may be a little bit more contagious, but they do seem to be reasonably well controlled by the vaccines, and especially good at preventing hospitalizations and deaths. So what we're seeing is that if you are vaccinated, if you're up to date, you might get COVID BA2, but you're very unlikely to get hospitalized or to die. So being vaccinated gives you about 10-fold protection over those who are not vaccinated. In Oregon, we're starting to see a slight uptick in cases, mostly in the Portland area and in Benton County. Again, in Oregon, most of this increase in cases is due to the BA2 variant. Douglas County has been very quiet. We're averaging about 2 cases a day. We go days where we only have a single case. And so we're at a relatively low spot in the pandemic. We're also seeing a very low number of hospitalizations. But again, among the hospitalizations, these are almost all in people who are not up to date on their vaccines. So what it tells us is that even though the vaccines aren't perfect, they're pretty darn good at preventing what we really fear the most, which is hospitalizations and deaths. There's some new stuff out about COVID in this last week. Moderna and Pfizer both have suggested they're going to be coming up with a specific vaccine which gives better protection against Omicron. That may be ready by this fall. And that would be part of this annual booster thing that we've been talking about over the last few years. The other new and interesting thing that I found is the FDA approved a breath test for COVID. So you breathe into a tube like in a breathalyzer, and it can tell within a few minutes whether or not you have COVID. This is very interesting and maybe a new part in medicine. We've known for years that people with certain diseases have a certain smell to them. So I go back in the years when I was doing a lot of pediatrics, and my nurse had an uncanny ability to sniff out strep. And so strep gives a very particular odor, and she was able to know almost as well as doing the test whether or not kids had strep. And so we've recognized that there are certain smells associated with diseases. Early on in COVID, there were certain dogs who were very good at picking out the smell of COVID and could pick out those who had COVID and those who did not. And so now what we're seeing is that this breath test does about the same thing and can sniff out those who have COVID versus those who don't. So during COVID, 2 amazing ways that we're looking for disease. One is through the breath. And I imagine that once this test is now approved and is more widely used, we may have other breath tests for other diseases. And the other thing that we're looking at for disease is sewage. So we know that when people have COVID, they excrete some genetic material in their stool. This genetic material gets into the wastewater. And by looking at the wastewater, you can see if the disease is circulating in the area, and you can even look for COVID variants in the wastewater. So I think what COVID has shown us is that looking at breath and looking at wastewater are going to be two really important things that we can use in the future for disease. The other new thing that's out there is that the new oral antiviral medicines are getting more widely distributed. These are medicines that you would take after you had COVID. You take one pill twice a day for 5 days, and it gives you pretty good protection, about 90% protection against being hospitalized. Those medicines were not widely available during Delta and not widely available during Omicron, but they're widely available now. So the recommendation is that if you get sick and have COVID and you're in one of the higher risk groups, you should really talk to your doctor about getting one of those oral antiviral meds. And the last thing that we have this week is about influenza. So that as COVID is coming down, we're starting to see a little spike in influenza. Just this last week, I know about a half a dozen people who've had influenza, and they tell me it's been miserable. So again, if you get sick, you should get tested for both flu and influenza. If you're positive for COVID, as we said, you can try one of the oral antivirals. And again, if you get sick with influenza, there is an antiviral for that called Tamiflu, which may be useful if you're sick. So right now we're in a good spot with COVID, and this is a time now to talk about other things. So Brian is with us today, and what we're going to talk about is childhood immunization. So we've talked a lot about COVID immunizations, but I think now we'd like to talk a little bit about childhood immunizations. And those would be like the tetanus shots you get as a kid, the measles, mumps, rubella shots, and the varicella shots. So Brian, thanks for joining us.
Pleasure.
So you and I are about the same age here, and we probably have personal stories remembering about a time before a vaccine. I remember one of my most vivid early memories is that my older brother had an illness that involved a stiffness of a joint when I was 4 and he was 6, and my parents were absolutely mortified that this could be polio. Turned out it wasn't polio. But in my lifetime, I can remember when polio was a real threat. And I know you have some stories about measles.
Yeah, also I remember that my mother had told me that when I was about 2 years old, my two brothers, one was 3, one was 4, and the measles and the chickenpox just came 1, 2, 3, 1, 2, 3. So as one was getting over, one of us was getting over, another one was getting it, and then that one was getting over it, and then the third one was getting it. And so that was like this very long, for my mother, not very pleasant time, because kids are, very unhappy and ill at ease and things like that. So she didn't have a very good time, I think, putting that together. But that was before we had a lot of these vaccines. And right now, I think the recommended vaccine series for children under 2 years old or under 36 months of age altogether will vaccinate against about a dozen different diseases or forms of diseases, including measles, mumps, rubella, polio. The fact that vaccines are working can be demonstrated just in the historical perspective about the numbers of cases before and after vaccines were introduced, and also in the numbers of deaths prevented before and after vaccines were produced. And right now, the data, at least the data that I have from 2007, shows that there was a 93% reduction in illnesses because of vaccines, and a 91% reduction in deaths due to those things. And there are some that have been reduced, at least in the United States, if not the world, by 100%, including smallpox, which has been eradicated, and close to eradication with polio. So we're getting very close.
Yeah. So I graduated medical school in 1980, and in 1980, there were still cases of measles around, and there was no vaccine yet for varicella. And what I remember is that kids with measles are really sick.
Mm-hmm.
So as much as people were thinking, oh, measles is just a week off from school, these kids are really, really sick.
Yeah, they are.
I was in an outbreak when I was in the military, and we saw a bunch of cases of measles. And I would tell you, the least sick kid with measles was sicker than anybody you've seen in the last year. These kids are really, really ill with temperature 105, 106, 107, seizures, pneumonia, whatever else.
Mm-hmm.
And so I am perfectly glad if I will never see a case of measles again. And chickenpox not quite as serious, but chickenpox led to all kinds of other issues. And I don't think doctors who are training now will ever see a case of measles or chickenpox or Hib meningitis, which is really, truly amazing.
Yeah.
So, Brian, I know you specifically have worked over your career with the eradication of polio. So I can remember this story with my parents just frantic, how my brother may have had polio. So tell us what's happened with polio in the world.
Well, it's been reduced by 99.99%. There are, I think in this year, there were like 5 cases that have been found. The only 2 endemic, meaning where polio might still be spreading wild, are Afghanistan and Pakistan. But even those countries have only found like 1 or 2 cases over the last 3 years. There was one wild case that was found in Malawi, but it was related to the strain of vaccine from Pakistan. So Africa, sub-Saharan Africa, was designated polio-free a couple of years ago. So this would be, I think the most likely explanation would be that it was an introduced infection, a strain that was brought over and reintroduced. So that's why high levels of vaccinations in a country are so important, so that these reintroductions of these infections don't occur.
And I would point out that the decreases in polio and measles and varicella and Hib meningitis are all there because of vaccine. It's not because of any great new antibiotic or some new machine we got. It's all because of vaccination, and we can see how well those vaccines do work. So, Brian, tell us about what happened during vaccines during COVID, because I know that, for example, in our clinic, it changed a lot of things. So tell us what happened with vaccines, childhood vaccines during the COVID pandemic.
Okay, well, the program that we at DPHN run under the Public Health Modernization Program is to improve the rates of 2-year-old immunizations among 2-year-olds, the immunization rates among 2-year-olds. Because COVID caused a lot of people not to seek health care, and the stresses and things like that COVID put on a lot of clinics, there were a lot of changes in practices at clinics that would see children and adults. And the state of Oregon did a survey in April of 2020 among approximately 230 clinics to see what the impact of COVID had on immunizations, on their practices, and not so much on the outcome, but just on certain areas of practice and effects. So what they saw was that there was a sharp reduction in routine immunizations of children and adults, that almost all the clinics had to change their immunization practices. Most clinics will have similar practices. That's one of the nice things about Oregon's immunization program, is that they have standards and they follow CDC recommendations. But they almost all of them changed, such as more than half of them reduced or limited their well child visits. So the children will come in for their routine things, but some of them changed their or limited their things. About 10% of them actually canceled well child visits. So even if they wanted to go, they weren't going to be going to that particular clinic. The ones that were giving vaccines did start to prioritize infant and newborn immunizations. So there was an emphasis to get them off on the right foot when they were first born. Half of the clinics or so had to cancel or reschedule immunizations for older children or adolescents. So they concentrated on the younger children, but the older children and the adolescents were sort of, I guess, shuffled off a little bit. Almost all the clinics had trouble maintaining staff because of COVID. There's been a lot of, I guess, turnover and changes in a lot of clinics because of COVID, not necessarily just in immunization, but in the clinics overall. Right now, they think that we think that most of the clinics that had changed their plans are planning on doing something to catch up. So that would be good, and that's one of the reasons why we wanted to reinstitute our program, which is based on the CDC's IQIP, or Immunization Quality Improvement for Practitioners. That program, I want to start implementing that again. And so most of the clinics are thinking about doing that. So again, I guess just to recap, some of the surveys results were that they modified their clinic operations, they limited care, they prioritized infant and newborn. They did implement telemedicine. Many of them couldn't see people, but if you don't see people in person, they're not going to get their shots. Have to be there in person. So that's what they did, and we're going to try and get those things in there back in order. Going to change their workflow to get their immunizations back to emphasizing vaccinations, and start implementing some of the IQIP processes again.
Well, great. And I think getting back to that is going to be great. Now, I have to especially note that some of the practices that gave the most immunizations, the pediatric practices, really stood up during the COVID time. So early on with COVID, we needed to give these vaccines, that complicated storage things. And so our pediatric providers in Douglas County really stepped up, and they gave vaccines not only to their own kids, but they gave vaccines to many adults. So two of our pediatric practices were our biggest immunizers, and they immunized, there was no vaccine for the kids, but they immunized the parents and the grandparents and the caregivers for the kids in their practice, and they did such a great job. Well, there's only a few of them, so that if they were giving a lot of COVID vaccines, the time they had to dedicate to other vaccines was down. But the good news is I don't think Douglas County slipped too much. We just got some preliminary reports from our school exclusion, and our school exclusions were really not that much different from previous years. So it really looks like our providers did a great job. So Brian, in Douglas County, I think we've got a pretty good group of immunizers, people giving immunizations. How do you see that?
I do. A couple of years ago, we started a community vaccine group consisting of clinic vaccine coordinators and practitioners. So COVID did to that practice what it's done to so many things, sort of changed the way we do things. But we're going to get back onto that. I've been back in contact with that key group of people. So we want to get the band back together, man. So
right. Well, that's one of the great things that we're doing in public health. I think each week now we've gotten a chance to see the different facets of what we're doing here in Douglas County for public health. And Brian, thank you so much.
You're welcome, Dr. Bob.
All right. Well, we'll do this again next week. Again, this is Dr. Bob Dannenhoffer, the public health officer for Douglas County, with COVID conversations and more. And we'll see you again next week. Bye-bye.